Hi, this is Dr. Robert Antlak from thegentledentist.com. We're located in Shelby Township, Michigan. Our phone number is 586-247-3500 and our website is thegentledentist.com. At our office we do a number of different types of procedures, everything from cleanings to dental implants to cosmetic dentistry. One of the most rewarding things we do is to help somebody retain their smile and get their smile back. And so what I wanted to do is to just go over what the difference is between what's called a complete denture and what's called an overdenture and what's called a hybrid denture. So I'm going to start from the very beginning. So this is a regular denture. It's removable. This is to fit the top teeth. And what it requires on the top is just for the roof of the mouth, since there's no teeth in there, for it to have suction so that when this goes in the mouth like this, it's retained by a suction from the palate, the roof of the mouth, and it creates a vacuum. The issue with a full denture is that there's nothing really to keep it maintained except if adhesive is used in the mouth. A lower denture is even a worse situation because a lower one requires the tongue to keep that denture pushed this way and the lips to keep it pushed this way. In between them is what would look like this. Between them is where the denture fits, and with nothing to retain them or keep them in place, the denture will actually flip out. It's difficult to chew with dentures because they are when you bite on them like this, only thing that keeps them in place once again is vacuum on the top or suction on the top and the tongue and the lip on the lower. So what's required, because people are not really 100% certain when they bite if they're going to be biting and hurting themselves, is that the ability to chew with a denture is probably only about 20% of that when we have our own natural teeth in our mouth. So obviously it's best to try to retain your teeth. The next level up from what's called the complete denture is when we can add implants in it, for example, to help retain and to keep that denture in location, in place. The benefit of having something like these little, they're like almost like little snaps that go there, and on the inside of the denture is there's other snaps inside of that, and what they do is once they go in place, they help to keep it maintained. The benefit of that is when someone's chewing their food, they know predictably where that denture is going to be, and therefore they'll feel more confident of not biting on some ridge or something like that that seems to be a potential for being misplaced and then biting down on the wrong way, hurting, and or for flopping out. One of the most embarrassing things that patients tell me is that something happens where they are with their grandkids and all of a sudden they laugh and then their denture falls out. There could be nothing more embarrassing than that. So these are a couple of examples of what are called removable dentures, removable complete denture, and then the overdenture. But the way that we can get around when you lose your teeth is to have what's called an implant. It's called a hybrid denture. A hybrid denture it's a hybrid. It's between a denture itself, like this is for the top, and what that also does is it's hybrid because it's actually retained by implants. And so it's actually screwed down. If we look at this, you can see little holes in the side of where that is, and those holes are actually where the implants, if you look here, it shows a clear model of where the implants would be placed. So those implants that are placed in the jawbone are there, and they're actually, once again, this is screwed down into the jaw. We take patients who have a number of teeth in their mouth. Through our technology using our cone beam scanner, we can determine the best place for the implants. So in one visit we can take their teeth out, we can actually put in implants, and then we can within 3 or 4 weeks later actually have a finished prosthesis ready to go so it gets screwed into the mouth. This gives people 100% confidence. Now that they can chew their food, since it's actually attached to the implants, it doesn't rest on their gums, and so they're able to bite down with much more force and confidence also. So this has been really favorable. We've been doing a lot of cases like this where we're really helping to change people's lives, And when we do that, we not only change their lives, but we change their ability to chew, the ability to have a healthier mouth because we get rid of their infected teeth, and they feel great about themselves. So please, if you have any questions about these, please feel free to call us. People ask often about what the range of prices are. Well, a removable denture, if someone has their teeth are missing, and the replacement of that is around $2,500, all the way up to, let's say you have all your teeth and you want them removed and have them placed by 6 implants on the top, that's around actually $19,000. So it's a fair amount more for sure, but the value you get from it is exceedingly high, and confidence and chewing ability and things like that, it really is a benefit. So please feel free to give us a call. Our number is 586-247-3500, or you can visit our website at thegentledentist.com. Thank you, and have a blessed day.